Thanks for your patience, everyone. The meeting should start in about 2 minutes. 2 minutes.
Good evening, everyone. Are you hearing me? My name is Janet Omisha.
Yes.
I am a student of Grand Canyon University, finishing up my Bachelor's of Science in Nursing. And I'm here this evening to present to you my Capstone project change proposal presentation. And I'm going to start. Thank you for joining me, and thank you for taking your time to listen to my proposal. The purpose of my presentation is to propose an evidence-based intervention in the care of patients with major depression. The evidence-based intervention is incorporating exercise in the care of patients with major depression. What is the objective of this exercise? Meeting exercise goals or challenge, even small ones, can boost self-confidence. Exercise and physical activities may give the patient the chance to meet or socialize with others. Doing something positive to manage depression is a healthy coping strategy. Exercise keeps us fit and stimulates neurotransmitter, particularly dopamine. Depressed patients may not be motivated because of the dopamine level. Because of the dopamine level may be lower than the average level. When dopamine is low, the depressed patient may have feeling of sadness, hopelessness, and emptiness. Objective of the proposal is exercise. Exercise is a planned, structured, and repetitive bodily movement done to improve or maintain component of fitness. That's the definition of exercise. Exercise has fewer side effects and can be structured as per medical comorbidity and functional status of patients. Exercise promotes self-esteem, and exercise is associated with less stigmatization than psychotherapy. The use of pharmacotherapy can be reduced when the patient is exercising. Exercise prevents and treats physical and psychosocial problems. Introduction. I am going to define depression. What is depression? Depression is a biological-based mental illness that may have lasting emotional and physical effects. What are the characteristics of depression? Depression is characterized by depressed mood, loss of pleasure or interest, feeling guilt or low self-esteem, disturbed sleep or appetite, low energy, and poor concentration. Depression is not a weakness, and one cannot easily snap out of it. Major tragic events are happening all over the world, causing people to be depressed. The COVID-19 is an example. In the USA, 32.8% of adults had elevated depressive symptoms in 2021, compared to 27.8% of adults in the early months of 2020 and 8.5% before the pandemic. What are the signs and symptoms of depression? Signs and symptoms of depression are feeling sad, anxious, or emptiness, feeling of hopelessness, feeling of guilt, worthlessness, irritability, loss of interest in activities or hobby one once finds pleasurable, including sex, fatigue, and decreased energy, difficulty concentrating, remembering details, and making decisions, insomnia, early morning wakefulness, or excessive sleeping, overeating, or loss of appetite, thought of suicide, suicide attempt, persistent pain or ache, headache, cramps, digestive problems that do not ease even with treatment. Those are the signs of and symptoms of depression. Worldwide effect of depression, what are they? Depression is the leading cause of disability worldwide, and it is a major contributor to the global burden of disease. World Health Organization 2021. Depression is a common disabling condition that affects over 120 million people worldwide. World Health Organization stated that depression is the fourth leading cause of disease burden among all diseases. Physical exercise. So what are the effects of exercise on depression? Physical exercise has been widely recommended in the care of patients with depression. Exercise has been connected with depression relief in various meta-analytic revisions, that is, various literature review. What is my PICOT question? My PICOT question are, will patients with major depression in the outpatient psychiatric clinic who incorporate exercise compared to patients without exercise have signs and symptoms of depression within 6 months? Intervention. So what is my clinical statement? My statement is with a patient with major depression who perform physical activities got improved, have reduced depressive symptoms weeks after the intervention. Exercise is evidence-based care for depression. Exercise effect on reducing depressive symptoms can be compared to cognitive therapy or antidepressant medication. The American Psychiatric Association recognizes that exercise can be used as monotherapy for mild depression in the acute stages after a diagnosis and monitoring mood by a health professional. What is the aim of this proposal? The change proposal aims to improve outcome in patients suffering from depression by incorporating exercise in their care. Exercise has fewer side effects, and it can be structured as per medical comorbidity and functional status of patients. Exercise promotes self-esteem, and it can be associated with less stigmatization than psychotherapy. And the use of pharmacotherapy can be reduced. More people can be productive in the community and less economic burden globally. More people can be, evidence show that when exercise is combined with the standard treatment for depression, exercise has a significant antidepressant effect over standard treatment alone. This is evident by the reduction in depressive symptoms. Physical activities like regular exercise provide an antidepressant effect, fear thermogenic effect, endorphin release, and availability of neurotransmitters and serotonin, dopamine, and norepinephrine. Also, physical activity reduces antidepressant effect due to this distraction from stressful stimuli. When direct comparisons were made between exercise and 4 evidence-based treatments of depression, exercise was rated as equal to family therapy, interpersonal therapy, and antidepressant medication. And exercise is inferior to cognitive behavior therapy. Methods of exercising. There are various methods of exercising. The method can be through telehealth, physical therapy, especially during this period of pandemic. Fitness app, home-based DVD, electronic treadmill, electronic bike, walking, jogging, running, using accelerometer that monitor the daily activities. The gym in the community can be used, sport club, and the choice of any of these depend on the patient preference, which the clinician will guide. A social worker can be involved to secure free gym membership for the vulnerable population. Exercise will be incorporated into the patient plan of care. Patients need to be consistent with the prescribed exercise. A patient will be involved with customizing the exercise based on the health condition, the exercise preference of the patient, and the exercise location the patient prefer to enhance the compliance. Evidence-based literature. Where did I find all this information? Well, I use a Senior Complete database. This is an important database for nursing profession. So the Senior database was used for the literature evidence-based. 8 first level of evidence peer review articles were reviewed and critiqued. All the articles support incorporating exercise into the care of a patient with major depression. All the articles are to review the association between exercise and depression. Does exercise affect depression? Are the people aware of the effect? Does unsupervised facility promote exercise adherence in patients with depression or not? The effect of aerobic exercise on depression, the clinician perspective regarding the use of exercise. The literature are peer review and a high level of evidence to support exercise as care of the patient with major depression. They are quantitative research, systematic review, meta-analysis, and randomized controlled literature. Resources needed. The resources needed to make sure that the patients are engaged in the prescribed exercise are, number 1, human resources. Collaboration with the treatment team, direct caregiver, social worker, psychologist, psychiatrist, and others who will ensure the proposal is implemented successfully is very vital. Technology. The information technology is needed to enhance communication among treatment team and also between the treatment team and the patient. Example are Zoom, team meeting, email, text messages, patient portal, fitness app, virtual fitness workout. Financial resources is another resources needed. A change involves money. There may be a need to secure funds for poster, flyers, organize Zoom meeting like this, and we may need to buy items like yoga mats, rope, and everything to make sure that my stakeholder, they understand the importance of exercise and they start prescribing it for the patient. The equipment we need, equipment needed, we have gym in the community, and most of the facilities like hotels, they all have a gym, and one can advocate to upgrade the gym that we have around to the modern electronic gym equipment. And exercising can be very cheap because you can do it in your home. You can have the fitness app and watch it and do it there. Anticipated measurable outcome. What are the outcome of exercising? When patient has depression and is exercising, what is the expectation? The expectation is, and it has been proven over and over by the literature review and the research. So the expectation is that exercise reduce depressive symptoms. Exercise improve mood and improve socialization. If patient go to the gym to socialize, or the exercise club, patient will talk to people there and socialize. Exercise makes patient not to feel guilty, and when they continue with it for a period of time, it allows them to have interest in what they like to do before, because what depression does that it makes people to lose interest in the activity they once enjoy. But once you commence on exercising, all these ones will improve and you will have interest in those activities again. Exercise reduces readmission rate. When you are exercising and you feel better, there is no need for you to be admitted into the hospital. And there is a tool that is being called Beck Depression Inventory. With exercise, 0 is actually the best score for this tool, meaning no depression, while 63 means highest depressive state. But when patients are exercising with the Beck Depression Inventory, the score is supposed will be like 0 to 10, which means patient is normal. So that's the measurable outcome. And the patient eventually will join the workforce, will be able to get up, dress up, and go to work, and then become productive in the community. Evaluation of intervention. Okay, when patients are exercising, how do I evaluate the intervention? Before I will evaluate the patient, I have to let the patient know the expectation first. So evaluation starts with patient teaching regarding exercise. We already defined exercise before as a planned, structured, and bodily movement done to improve or maintain one or more component of physical fitness. So patient need to be consistent with the exercise. The patient will be involved with customizing exercise based on their health condition, like I said, based on their preference and the location they want. Teleconference and video can be made available to patient to monitor the patient for compliance. So I will educate this patient on Beck Depression Inventory. This is a tool to measure the state of depression of the patient. The lower the score, the better the patient, meaning that the patient is improving. So, but when the score is high, it means that the patient is not improving. I'm going to educate them on it. Beck depression inventory has 21 items, and one of each item is 0 to 3. 0 means no sign of depression, while 3 means severe signs of depression. So after completing the questionnaire for the Beck depression inventory, the number of each of the 21 items will be added, and the highest number is 63, like I said, meaning the patient scores 0 on all the 3 items, and the lower is 0, meaning the patient score 0 on all the 21 items. A score of 10 is normal. 11 to 16 is mild depression. 16 to 20 is borderline chronic depression. 21 to 30 is moderate depression. 31 to 40 is severe depression. A score of 14 and above is extensive depression. Before evaluation of the intervention, we just do the initial assessment of the patient to determine the baseline so that we know what to compare the patient's improvement with. Based on the condition, weekly evaluation can be performed with the patient over the phone, teleconference, telehealth, and then if there is improvement, maybe there is reducing in these depressive symptoms, or if there is increasing or it remains the same, we can do it over the telephone conference or telehealth. So a low score means improve in patient condition. So if this happens, then we can be evaluating every 2 weeks for 2 months and monthly for 3 months. So conversation with the patient to complement Beck inventory is necessary. Apart from evaluating all these numbers, we can still talk to the patient, how the patient is feeling, what the patient like to discuss, how we can come in to help the patient. Normally, we encourage patients with mental illness to verbalize their feelings. The patient may have reduced readmission rate. Then the patient may even report socializing with others, eating normally, grooming well, and having interest in what he likes to do, and working and being productive at work. These are signs that implementation yield good outcome, good patient outcome. Hi, everyone. Any questions so far? Hello? Is there any questions so far?
I have no questions at this time.
Okay.
No, thank you.
All right, thank you.
No question. Excellent presentation.
Thank you. Everything costs money. Nothing is free. So what is the cost of this intervention? Well, I will tell you that exercise is the best. It's less expensive than other treatment of depression. Because antidepressant is very expensive, and each therapy is approximately $100 per section. Depression ranks among the most costly health conditions in the United States. 71 billion is the amount spent to treat depressive disorder. It is the most costly among mental health and substance abuse in the USA. Depressive disorders are the 6th most costly health condition overall. People with mental health condition are vulnerable. Social worker can work with them to get free membership for them. And they are also covered under Affordable Care Act. And the average membership cost for depression in the United States is $37.71. So we cannot beat that. That is very, very lower than the cost of antidepressant medications, Depakote, lithium, and all those ones. They are highly expensive. So This is just when you compare the price of monthly supply of those with $37 of membership for gym, exercise is less expensive and it has less stigmatization. Is very good to take care of patients with depression. Okay, now what are the benefit analysis? I have said it over and over. If a benefit of exercise cannot be overemphasized. Let's start from head to toe. Looking at it has effect on the brain health. It reduces risk of depression and anxiety. It improves sleep quality. And the blood pressure, it reduces blood pressure. Exercise lowers the risk of heart disease, stroke, and type 2 diabetes. Exercise has been proven to prevent depression, lowers risk of 8 cancers, bladder cancer, breast, colon, endometrium, esophagus, kidney, lung, and stomach. Exercise allows us to have a healthy weight, and it reduces the risk of weight gain that can lead to obesity with all its complications. Exercise allows for bone strength. It improves bone health. And then when you are exercising, your bone is strong and you have balance, and you are well balanced and you are well coordinated. And then when your gait is balanced and you are well coordinated, there is less chance of falling, so it reduces risk of fall. So we want to ask, how much will it save on the long run? There is a saying that says, health is wealth. A healthy nation is a wealthy nation. Spending on exercise instead of 71 billion on medication, exercise is preferred. So there will be a reduction in the amount of money spent on the antidepressant medication. So that's how much is going to save on the long run. I have my references, and if anyone have questions, this ends my presentation. I'm available for questions, and as much as you can, anything you want me to clarify. Thank you very much for listening. Is there anything you want me to clarify? Hi, everyone.
Hi, nothing to clarify from my side.
My name is Morate Oluwakuide. Thank you for this presentation about the benefit of exercise in alleviating major depression. Please, this exercise, how for the effect to be felt, how many days a week and for how long should we be exercising to be able to see the effect, to have the desired effect on our health?
Thank you very much, Dr. Morade Oluwakuide, for that great question. Actually, exercise, according to CDC recommends 150 minutes of exercise per week, and you can divide it up 30 minutes per day for 5 days. It has to be consistent. And for it to have this effect, patients need to consistently be exercising, as I said, and then we're going to be monitoring. But by the end of 6 months of exercise, there will be concrete, according to all the literature review evidence, that exercise has really done the work of alleviating depressive symptoms. Any other question? Is that okay? Is that clear, or is there any other thing?
Yes, ma'am.
Dr.
That's
Luakwide.
clear. That's very clear, ma'am. Thank you.
You're welcome. Thank you for joining us.
You're welcome.
Any other question?
If I may ask a question quickly and make a little contribution. Excellent work. A lot of work was put into this. One thing, when we talk about systematic literature review, the clause systematic means that each segment of literature you are presenting, or you have to delineate one from the other. A good example, we're talking about exercise therapeutics, and you did mention how it affects neurotransmitters and all the other thing. Then you jumped into another set of effects, then you went back to exercise therapeutics. When you say systematic, please stand, put everything into their respective compartments, in which case we are not going to jump too much from one to the other. Otherwise, it makes it difficult for your audience to follow through and see the extent of work that was done. And regarding those exercises, you were talking about neurotransmitters being affected. You were talking about other influences. You have to give us the direction. Okay, does it reduce? Does it increase? And in a scientific presentation, you have to give us figures. Typically, it goes from about, serotonin goes from about this and goes down to about this. That makes it that it's systematic and it's well informed. We need to add that one to the body of the presentation. I did say thanks to Dr. Olukwide for bringing the effect of the dosage of the exercise. That's the most important thing, because you say it has to be structured and it has to be prescribed. So that dosage is important, and it's on the principle of FITT, frequency, duration, that is how many times a week, okay, how long each time, and the intensity, okay? So for a literature review at this academic level, you also have to give relative figures. The 30 seconds and all, or 30 minutes, 3 times a week, and all the other things have to be indicated. And one big thing about exercise, even when you don't have that way of quantifying, is the amount of stress, physiologic stress the patient will sort of feel. In which case, sweating is a mark that exercise intensity is good enough to provoke physiologic changes in the body. And the other thing is that breathlessness as a form of exercise, especially when this might be done in an unsupervised environment. So please put that as part of the literature and put that arrangement so that your literature review is really quite systematic. I wish you the best, please.
Thank you, Dr. Kokwala. Am I correct?
You called the right name, ma'am.
All right, sir. Thank you very much. That's a very good addition from Dr. Popola. Thank you for listening to this presentation. I really appreciate those contributions. And for the neurotransmitters, it is when they are lower, then patients feel depressive symptoms. I will look into the level they're supposed to be in the next presentation if I'm given the opportunity to do that. Thank you very much. I really appreciate. Is there any other addition or question? My preceptor, are you there? Miss Abby. Hello, ma.
Hello, sorry, I was on mute. I'm here. I was talking, but
anything you want to say?
Nice presentation. Thank
Yes,
you so much. Thank you.
You're welcome.
Excellent presentation.
Yes.
And we really learned from, I may not know Dr. Popola, But actually, from the academic views, he has really put in a lot into it.
Yes.
The functions of the neurotransmitters, the way exercise will boost those neurotransmitters, so that that patient that is depressed, that stays at home, although he's taking the medication, continue to sleep. But if there is encouragement for him to walk around through the neighborhood 30 minutes per day, is going to really make a difference, make him feel better. And by the time he's able to engage people in the gym, talking to peers, make him feel better by the time he returns home. So these are some of the silent things that healthcare givers, the nurses, the doctors, the MPs, needs to, talk to their patients. All is not about take this antidepressant, take this antidepressant. Our body can be, simulated in such a way that it take care of most of these depressive action that wrecks our body. Excellent contribution, and thank you, Dr. Pubola. Thank you, Ebi, and others.
Let me just quickly add a little bit, because you touched on that too. One of the reasons why you have to have a metric, that is measurement, is that when a patient goes from a level to the other level in 2 weeks, in 2 months, in 3 months, he gets motivated. He sees the direction of change, and that adds to the motivation. So the measuring the quantity, the amount of exercise you're doing, measuring the amount of effect, and that takes me to one very important in the RPE score, rating of perceived exertion. If you could do a certain amount of work, let's give a rating of 0 to 10, which is the most commonly used. Sometimes it's 6 to 20, so that it will fit more about your blood pressure measurement. But either of the two is good enough. If an amount of exercise gives you, that is a subjective rating scale, let me put it that way, the most accepted one for exercise monitoring. If a patient starts and can do an amount of work and he gets started to a level 7, which is hard. Okay, 8 is very, very hard. 9 is very, very exhaustive. 10 is I can't take it anymore. I can't go beyond that. And after 2 weeks, he does the same amount of exercise with an RP score of 4, which is mildly difficult, something like that, or fairly hard. Then you know that patient is improving. Okay, so these are some of the things you put in there that shows that there's an academic rigor. That is, you got the substance and you have what it takes for the patient to monitor herself or himself, or anybody who's monitoring the patient gets to understand it a little better. Same thing for the pharmacology. Is the dosage the patient is having, is it going to be kept steady during the course of exercise, or you tend to titrate? Literature will tell us a little bit of that, and you have to tell us why you are not going to be titrating or varying the amount of medication. Because those are the reasons why you are doing your literature review, to point out why you choose a direction rather than leaving everything open. You have to, your literature review will narrow into your subject, into your research questions, which you very, very well articulated. Also, too, that one should be listed 1, 2, 3, 4, 5, 6, as many as 10, usually not more than 10. Otherwise, your work will be too much. So put all these things to make it more, to give the content, a lot of content that you put in there, but to give it the power of academics and scholastic input that you have put in, and also to give it more structure and organization. Yeah, thank you very much. My privilege, please.
Thank you,
Thank
sir.
you so much.
Mr. Ebi, your hand is up. I appreciate that.
Learning something for every one of us. And it's my pleasure listening to Dr. Pupola and the presenter. Thank you so much. We really appreciate your contribution. It goes a long way.
Thank you so much, Mrs. Omishake, for the nice presentation. I believe I'm going to use your research and evidence base in my practice and try to encourage my patients to incorporate exercise with medication. Thank you so much.
You are welcome. Thank you, everyone. Thank you. Thank you. I learned from you a lot. I learned from everyone. We learn from each other. Thank you very, very much. We are towards a common goal, patient outcome. I believe everybody I have online, we are all healthcare workers. Very good.
I have an additional comment.
Yes,
my name is Mrs. Folashade Ojo, and I really learned a lot from your presentation. I now realize the importance of exercise for the patients instead of all the time giving them antidepressants and all this. This, your presentation will enable me to encourage my patients to do more exercise, as it will help them more. Thank you for the excellent presentation. Thank you very much. Okay.
Thank you, everyone. I appreciate you for joining me. Thanks for your time. Thanks for your contribution. Thanks for everything. And God bless you all. If there is no other contribution, is there any other one? I really want us to exhaust everything we have so I can learn from this presentation. Is there any other additions or subtractions? In the absence of none, I will say thank you and have a great evening. Bye-bye.
And we still have to say special thanks to your preceptor, Ebby Alofe. I know she put in a lot of hours into see that she guides you through this course. And, rounding up this capstone presentation, it reflects, and I hope our name will go on that paper that you are writing, just a sort of appreciation. Thank you so much, Mama Ebby Alofe.
Thank you, sir.
All right.
Okay,
sir.
I dedicate my presentation to Miss Ebby Alofe.
Amen.
My presenter. Thank you, everyone.
But what happens to the fact that the benefit and gain of the teacher is in heaven? You want to give her from here?
All right.
Okay.
The preceptor and student, great.
Thank you. All right.
Okay.
Bye-bye.
Good night, Mama Oluwakuyide Anko. Good night, Mrs. Ojo.
Good
All
night.
right. Eshemao.
Thank you,
Night.
sir.
Okay.
Thank you, Ma. Thank you, everyone.